Conversation is Dr. Roy Semlacher. And Doctor, we thank you very much for getting up so early to join us.
Good morning.
We were showing earlier some young women who were on Good Morning America who for a graduation present were given breast enhancements.
Yes.
And they titled it Cleavage or Cars. There's a controversy. Is it too young for a woman at that age to have breast enlargement, or what is the right age?
Well, I don't believe there's really a right age, but you do have to understand that with breast augmentation, you're accelerating the aging of the breast. So someone's going to have their heyday where they look very good, and then they're going to pay the price later, especially if they go extremely large. So these are factors that people really have to take in consideration, especially when somebody's very young, as opposed to someone who's maybe in their 30s, who've had their children, they don't like what the breasts look like anymore after pregnancy. For someone like that, you know, to give them another 10, 15 years of looking good is excellent. However, if you have someone who's 18, you have to consider that. You know, maybe at 25, they're not looking so good at 30. So these are considerations you have to make.
Although at this point in their lives, maybe they're not thinking 5 or 10 years down the line. They're looking for the immediate gratification.
Well, exactly, and that's what behooves the physician to get that across to the patient and to their significant others or supportive family, that there are ramifications to what they're doing, just like with the tattooing and the body piercing that's going on today. What seems like a great idea at 18 may not be so good when you're 25.
Now, as we were talking about this topic, getting ready for this morning's show, one of the points we made was it's hard for this person to judge that person, because if it's something that really makes that person feel better about themselves, isn't that what it's all about?
Well, it is, but it's also, as a physician, you have to understand it's not like you're getting hair coloring, and if you don't like your hair color anymore, you can change it. This is something that's going to affect the rest of your life, the way you look. And yes, you're right, there's a very positive component to it. You bring the body proportions, and they feel much more attractive, and that, of course, makes them feel more confident. It makes them even more attractive as an individual, and perhaps that'll help them significantly. But you also have to be careful, because a lot of people are very impetuous, and they feel like this will make a difference in their life, and then they'll find that it really doesn't make a difference. It's still the individual on the inside that makes them successful in business or in a relationship or whatever.
Earlier we put up some of the costs for these procedures, so we can go ahead and put up that graphic again, because there's a curiosity as to how much these various procedures cost. But I was wondering, in your practice, have you ever said no to a patient that they wanted a certain plastic surgery procedure and you just thought it was perhaps for the wrong reasons, or they were not mature enough to handle it, or they were putting themselves at risk?
Yes, many times
You've said no.
Oh yes, some women, as for specifically for breast augmentation, there are limitations at how big I will make somebody, especially if their body size doesn't, it doesn't proportional to me what I find it is aesthetically attractive. And then also, the larger you go, it's been shown that there are more untoward long-term effects. And in those individuals, I'll just pass, because there are other physicians who are happy to do it for them, and I don't want to deal with them 10 years down the line when they have those issues, because it's something I've created for them.
We've talked about breast augmentation. What about breast reduction? Is that a whole different ballgame?
Yes, that's a different scenario. You're going to have somebody with very large breasts who it's affecting their lifestyle and things. Yeah, that's a difference. There's more medical reasons to be doing that. They have neck pain, things like that.
We were talking about younger people having more plastic surgery. Are you noticing more men? Is that another new trend in this business?
Yes, yes, because it's become much more mainstream. Cosmetic surgery is something that's done behind, like people don't talk about. Now it's up front, and also men are just like, the metrosexual, having their hair done and everything, and the skin care and everything. That's just today. It's a trend.
Well, obviously this is how you make a living. But
yes.
Does it disturb you somewhat that so much emphasis is placed on one's appearance, or is that just the way society is nowadays?
Yeah, as you're right. It's good for my business.
Yes.
But yes, it is concerning. But the whole society has been shifting, and now you and I were talking more and more like our parents. We're sounding like our parents. We didn't agree with what was going. They didn't agree with what was going on then, and there's a lot of things now that I think are just unnecessary, and people are very superficial.
Well, Dr. Roy Semlacher, we thank you very much for getting up early. You have a business practice here in town?
Yes, I do.
We should mention people can look you up in the yellow pages?
Yes, or actually on my website.
Okay, and that is?
It's New Visage. It's new-visage.com.
And we will put a link on the News 10 website as well to you.
Appreciate it.
We thank you very much, Doctor. Good luck.
Thank you for having me. Thank you.
Hour number 2 of News 10 Good Morning coming right up after this.